Thank you, Wendy. Some of you may be aware, you might have caught it on the radio this morning, that a certain Ed Miliband is giving a speech up the road at a much less significant gathering than this one. And he's going to say that, of course, they need to recapture, apparently, some of the spirit of the Attlee government in 1945. That's an astonishing statement. Whatever happened to that Labour Party in 1945? The Attlee government gave us 9/11, nationalisation, planning and a welfare state. Ed Miliband is offering us Ed balls, cuts, markets and happy bankers. Or to put it more succinctly, balls, balls, balls and more balls. And more to the point when we're talking about the healthcare system, he's also offering us Lord Warner. Lord Warner is the so-called Labour peer who's argued and voted in favour of the Section 75 regulations compelling the marketisation of healthcare services for the amount of competitive tender. He's also just been awarded the Fourman of the Year award by the extreme right-wing organisation Reform for actually arguing for charges to be introduced for healthcare. Lord Warner broke a 3-line whip in the House of Lords. He is still an active leading member of the Labour Party in the House of Lords. That really spells it out, I think. This is the type of leadership we've had from the Labour Party over the last period of time. And I think it's important to recognise what's at stake here, because the gains that were put in place by that Labour government in 1945 to 40 to 51, that Labour government then put in place massive gains which are still important to defend now. The NHS was fought through against Tory opposition in 1948, launched 65 years ago on July the 5th, 1948. And it superseded the failed market that existed before it. It completely transformed the possibilities of accessing healthcare for a vast majority of the population. Healthcare was no longer a commodity to be bought and sold and paid for as you accessed it. It became free at point of need, funding from taxation, an absolutely basic principle. But it also involved the nationalisation of the network of hospitals. The completely ramshackle network of hospitals which were next door to each other in many cases, but didn't work together, didn't speak to each other, organised separately, and so on. The charitable hospitals, voluntary sector various hospitals, the teaching hospitals, and the municipal hospitals, all running separately, all without any coordination whatsoever. They were brought into one nationalised system. And that again meant that the local hospitals could link up. You could have collaboration and cooperation between health professionals. You could develop modern medicine. That's what the NHS meant in 1948. And that's what's at risk now under this current government. What else could you do under the new NHS? Well, you had a national training system for doctors and for nurses became possible for the first time. You had a career structure for doctors so they could be promoted and move through the ranks and rise and develop their skills as they went. You could plan services, you could actually allocate resources according to social need, not follow the whims of the market or a benevolent lady or Lord Bountiful who write a cheque every so often for a small local hospital in exchange for obviously enduring gratitude from the local population. And it based originally the notion, put forward the notion of treatment on the basis of health need and not on ability to pay. The Health and Social Care Act smashes all of that. All of that is undermined by the Health and Social Care Act pushed through by this government, building, I have to say, sadly, on the massive erosion of the service that took place under Labour in the period from 2000 up to 2010. The Health and Social Care Act breaks up the NHS, fragments the NHS. The payment by results system, which is central, which Labour brought in, which is now central to the new system, means that healthcare is again a commodity, because it's a game reckoned in how much it costs. Okay? Every item of treatment is costed. Every item of treatment is recorded and accounted. That wasn't necessary under the NHS in 1948. It was an integrated system, a nationalised, centralised system. You didn't have to do it that way. The people supporting the Health and Social Care Act welcomed it as an act of denationalisation. And that's what it is. It's opening up the possibility of more and more non-NHS, non-public sector suppliers to move in and provide services. That's what it's all about. It's about fragmentation, it's about competition, it's about creating a market in place for the healthcare system. It's a deliberate policy. It's not an accident. This is a worked-through policy of a government that hates the NHS. We have a health secretary now who's on record wanting to break up the NHS and privatise it. I don't think we've ever had one of those before, and it's not a particularly good step that we've got one now. It's also headed down the road of rationing and exclusions of services, because it runs hand in hand with massive cuts. We've got massive cuts on a scale never attempted before in any healthcare system anywhere in the world. 4% a year, real terms cuts, year by year for 5 years in a row, never been done anywhere at all. Even Stephen Dorrell, former health secretary, actually is saying, a Tory, actually saying that it's not at all clear this can actually be done. Massive, unprecedented cuts. So we're getting services no longer available on the NHS, services excluded. People finding it impossible to access the treatment they need. It's the end of planning, because we've had the NHS broken up into all these different clinical commissioning groups, which aren't all together, aren't obliged to talk to each other, aren't obliged to plan together, and which each of them has to balance their own books and run as a business. Each of them, as a result of the Section 75 regulations, which Lord Warner supported, although actually Labour opposed, the Section 75 regulations compel them, or are intended to compel them, to actually put more and more of their services out to tender. And we've got the fragmentation has reached the point now that when Jeremy Hunt went on yesterday, he talked about patient safety. He can't guarantee patient safety because he smashed up the system that might ensure patient safety. Right? There's no way the Care Quality Commission is one body, even if it was better run than it is, even if it did have some competent people in it, which it doesn't appear to. Even if that was the case, how can one organisation centrally run all these separate, competing organisations, these foundation trusts that are not accountable to the NHS structures, and an NHS that is now no longer accountable through the Secretary of State to Parliament? How can one body do that? It's impossible. And what we've had instead is all these local toothless bodies, health watch bodies set up, but what we need actually is the old community health councils back at local level, actually monitoring and vetting standards and fighting to make sure that when things go wrong, they're not wrong. This massive health squeeze on services is really starting to take a toll. They've got 5 years coming with no growth whatsoever, whilst demands and pressures on the NHS go up by an estimated 4% a year. That's a 20 billion gap. It's called, by Sir David Nicholson, the outgoing chief of the National Health Service, it's called the Nicholson Challenge. It's called the challenge. I call it the banker's challenge, because the reason that money isn't there for the NHS is because they spent it bailing out the banks. And while they say that the savings are going to be recycled in the NHS, we've already seen that every pound being saved is actually being scooped back into the Treasury and used for tax cuts for the rich. We've got thousands of beds have closed already since 2010. Jobs are being axed, jobs are not being replaced when people leave. Waiting times are up, operation cancellations are up, ambulance waiting times and delays are up. All across the country, mental health budgets have been slashed. For the first time, down 1% in a full year overall, and local mental health services massively under strain, being cut to the ribbons. And it's all compounded, of course, by the private finance initiative, pure financial incompetence. PFI, the most expensive way you could possibly imagine of financing new hospitals, which has bumped up costs massively, bankrupted the South London Healthcare Trust, forced the closure of services at Lewisham Hospital and triggered that massive fight back down there, but also is now jeopardising services services in Peterborough, which is right on the brink, has no money to pay its bills. Sherwood Forest Health Trust, no money to pay their bills, and a dozen or 20 trusts up and down the country, right on the edge of bankruptcy as a result of PFI. What's the government's answer? More PFI. More PFI, slightly modified PFI, son or brother of some kind of descendant of PFI, but basically more of the same old busted formula. And alongside all of this, it's a three-pronged attack. We've got the Health and Social Care Act, we've got the cuts, and we've got privatisation. Unprecedented privatisation. We've got the community services are the main attack point now for the private sector. Virgin, Serco, strutting around trying to pick up contracts. Cambridgeshire putting £1 billion of community services out to tender, with Virgin and Serco seen as the front runners. Virgin offering sexual health services in the south of England. Virgin offering child mental health services in Devon, which even the judge, when it was challenged in court, admitted they had no real reason to be able to do this, but there wasn't sufficient legal grounds to overturn the decision to give them the services. These companies moving in, sizing up the bits of the NHS they want, determined to leave the rest to the public sector to pick up the bill. So they pick up the lucrative bits and pieces. Then, of course, again, as the NHS squeezes down emergency services, the hospitals fill up, NHS hospitals fill up with emergencies, the private sector's there, in the wings, licking their lips, hoping to carve up more and more of the elective operations that actually make them the money. That's what this private sector really actually does. So who's gaining? The private sector. Who's losing? All the rest of us. Everybody loses. Even rich people who don't realise it still need the NHS. Nobody else does emergency care. Nobody else does maternity care. Nobody else does chronic and complex cases but the NHS. The NHS is cut, we'll lose. Everybody loses. It's a universal service, and we have to defend it that way and fight for it that way. An injury to one is an injury to all. Let's keep our NHS public. Let's fight for it in every way we possibly can. Let's step up another gear and battle against every kind of privatisation. Let's keep our NHS in one piece and let's keep it public.